So today we're going to talk a little bit about the science of addiction, and in order to really understand that, we have to understand that the opioid crisis is far from over. The United States government announced recently that 110,000 people died of overdoses in the past year. There are overdoses on a regular basis in all Munson communities. There are people receiving Narcan on a daily basis in our regions. And we continue to lose people at an unacceptably high rate to either the complications or from overdoses due to opioid addiction. Addiction is a medical condition. People who are struggling with addiction are struggling not with a crisis of willpower, but with a disorder in their brain chemistry that impacts their ability to function on a daily basis, to manage their daily stresses. To understand addiction, we have to understand how our brain reacts to a chemical called dopamine. Dopamine is our happiness chemical. The higher the levels, the happier we are. We're going to use some numbers just as examples. These aren't actually the numbers in our brain. But on an average day, our dopamine level is 50. I went to work, nothing terrible happened, nothing great happened. I'm at 50. On my best day ever, it's my birthday, I got cake, exactly what I wanted as a present, I might get to 100 because it's my best day ever. And on my worst day ever, lost my job, it snowed, the snow melted before Christmas, I might hit 25. When we use substances that are addicting, our brain overreacts with dopamine. Now that amount of overreaction depends on the substance. Many people start with something like nicotine or alcohol, and our brain's dopamine level the first time we use those may hit 200. But addiction starts because at 200, our brains love being at 200 our dopamine, and they're always going to want to go back to that. So they try alcohol again, only this time, it doesn't reach 200. We may start pursuing other ways to get to 200. But what also happens is when we stop using, our dopamine levels fall lower than that 50 average. If I'm at 5, my brain is so unhappy that I might not eat. I might not take care of my kids. I might not get dressed or go to work. Our brains continue to send us a signal louder and louder that we should try something to get back to that high dopamine level. And instead, we're never able to reach it. And that pursuit of that dopamine starts to dominate everything else in our lives. And that's when addiction has really started. If someone in your family is struggling, the best thing you can do is understand them, support them, make them safe through harm reduction, having Narcan available, continuing to offer to support them through treatment. Understand that treatment may take years before they really feel like they're back to normal. But you can also access all of the same resources to help support your loved one as they struggle with this terrible disease.